His name Kimberly Wells. Age is 52 years, and today date is 18th of August 2023. And complaint of change in voice from 2019 after vocal cord polyp surgery. And at present, any finding is right vocal cord paralysis, and went for surgery for 2 times, and that was an injection thyroplasty, and the surgery effect was temporary. So she want to take voice therapy. Yeah, so tell about yourself and your problem.
Yes, I've never had voice problems until 2019 when they found some polyps. So I did a surgery to remove the polyps. After the surgery, my voice just did not return. It was very breathy, and as several months went by, and they were not able to help my voice return. So I was sent to a specialist who decided to do a surgery to inject my vocal cord, which helped, but it didn't last for very long. And so they did another one, and the same thing happened. So I'd like to try the therapy to see if we can do that without another surgery, if that's at all, possible. I want to go that route.
Post-therapy video of Kim, and today date is 16th of January 2024. Kim, what was the problem? Why you contacted us, and how do you feel after the online voice therapy?
I contacted you because I have a paralyzed vocal cord, and the only treatment options I was given was more surgery, which I did not want. So I contacted you to see if we could do therapy and make my voice stronger in a way that would eliminate the need for surgery again.
So I think you had dysphonia due to unilateral vocal cord paralysis, and we give online voice therapy. So what are the reactions you are getting from your family members or friends, or in fact in your school of your students, from your students?
The comments I receive include ones that they can't believe how much stronger my voice is, and that I can carry on conversations with them. They can hear me just fine. And my students are very excited that sometimes I can go without my microphone in class and they can still hear me.
So what is your profession?
I'm a teacher, second grade teacher.
Where do you stay?
I'm in United States, Florida.
Okay, so in spite of staying in Florida, United States, you have shown faith on us and you're feeling better. So we are also very happy for you. And can we use your video for awareness purpose at our social media pages?
Yes, please.
So thanks for the permission. And those who are watching this video, if you're able to see any positive change in Kim's pre and post treatment voice, please like this video, share this video so that people having similar problem can get hope, motivation, and they should also know that there is a non-surgical management as well, because Kim has already you have gone for surgery, no? And then you decided next time I will not be going surgery.
Yes.
Okay, so how many times you went for the surgery before contacting me?
I've had 2 surgeries.
Mm-hmm. So again, earlier surgeon suggested to again you have to go for surgery, but you're more interested in the voice therapy. You don't want surgery, is it?
No, I do not want the surgery that they're proposing to me. It's very invasive, and I have really enjoyed doing the therapy for my voice as a way to get around.
So now you feel your decision was good, is it?
Yes, very much so.
Yeah, because taking voice therapy and you are feeling better and you don't want to go for surgery. So those who don't want to go for surgery, for them the option is non-surgical management also in communication disorders like vocal cord paralysis and dysphonia. This is just for the awareness. So thank you so much, Kim, and thanks for watching, those who are watching this video. Thank you.
Yes, you're welcome. Thank you.